All right, so urology, the study of the urinary system. I'll be referring to the textbook today because I looked through the PowerPoint, not a whole lot of pictures in there. Of course, we'll pull up some online as well, but we'll be using the pictures in the textbook as we go through the section. So starts on page 527. All right, and let's start on the PowerPoint with urology. You can probably pick this one out pretty easily. Uro refers to urine, and then of course logy is study of. Today we'll be using the words nephro and reno interchangeably because they both mean kidney. For example, the nephrologist is the kidney doctor. The artery that leads to the kidneys is the renal artery. So we'll be using both terms interchangeably today, nephro and reno, both meaning kidney. And then the nephrologist is the kidney doctor, and the urologist works on the urinary system itself. So if there's something specifically wrong with your kidneys, like diabetic nephropathy, disease of the kidneys, then you would see the nephrologist. But if you have a stone in the urinary system somewhere or a urinary tract infection, you would see the urologist. So one working specifically on the kidney, the other working on the entire urinary system itself. And that might be an example of overspecialization. One of the things that drives up the cost of healthcare. You go see your urologist for kidney stone, and it turns out, oh, it's not a stone. It's a problem up in your kidneys. You have a kidney infection. So now I'm going to send you over to the nephrologist. Really? Another doctor? After paying for this visit, now I have to go pay for another visit. So it's one of the reasons for the high cost of healthcare is overspecialization. Some doctors will be just the kidneys. It's like a doctor who does just GYN. I don't do OB. I don't deliver babies. I just do GYN, overspecialization. All right, so, and that's one of the reasons that at Quest we do multiple certifications. So we're not just so overspecialized out there that we can't find a damn job. All right, so urologist, this doctor we need to speak a few seconds about. They will work on urinary system in men and women both, and then the reproduction system in men. In women, the GYN doctor will handle the reproduction issues. But in men, since the urinary system and the reproductive system share the same structures, the nephrologist will work on both of those for men. Urinary and reproduction. In women, the tracts don't share the same, they don't share the same tracts or tubes. So in women, the GYN doctor will take care of the reproductive issues. All right. So that is the word parts that we'll be kind of using today. All right. The purpose of the urinary system is to eliminate liquid waste. Our kidneys will filter the blood, pull out everything that is not part of the blood or that shouldn't be there, all the waste products, and then filter those out through the kidneys and down through our urinary tract and out of the body. So to eliminate liquid waste, I don't like the color, and also to regulate our electrolyte balance. Our kidneys have the unique ability to look at electrolytes as they pass through the urine, electrolytes being sodium, potassium, calcium, chloride, and sodium bicarbonate. And the kidneys can detect sodium and say, hey, that's good stuff. We need to redirect that back to the blood flow. But the potassium, let that stuff out through urine. So that's a pretty complicated filter. In most instances, when we're talking about filtration, simply what we're doing is filtering things based on size. Those things that are small enough will pass through the filter. Those things that are too large will be directed back to blood flow. But our kidneys have the ability to detect the difference between sodium and potassium, sending the sodium back while allowing the potassium to exit the body, which is a very important function for us, and we'll be talking a little bit more about that later. The kidneys also regulate our blood pressure. Remember we said the the things that contribute to your blood pressure, the four things: the diameter of your blood vessels, the contraction of the heart, the thickness of the blood, and the amount of blood in the body, or amount of fluid in the body. So the kidneys can regulate blood pressure by releasing excess fluid, thereby bringing your blood pressure down, or retaining fluid, thereby bringing your blood pressure up. So if you've lost a lot of blood, then the kidneys will shut down and retain the fluid so that you can keep it to stay alive. But if you have high blood pressure, then the drug that will almost always accompany your high blood pressure meds is the Lasix, the water pill, to help you pee off some of that extra water and hopefully bring your blood pressure down in the process. Yeah. And the kidneys also release a couple of hormones in the body that will control your urination and blood pressure. All right, so that is the purpose: to eliminate liquid waste, or those are the purposes. To eliminate liquid waste, regulate our electrolyte balance for us, and regulate our blood pressure as well. And today we'll be talking about what the electrolytes are. All right, blood pressure regulation. Let's start with that one. The kidneys help to regulate our blood pressure by secreting a substance called erythropoietin. I called them hormones a minute ago. They're not really hormones. They're substances released in the body. Erythropoietin is how that's pronounced. Erythro means red, and poiesis means to produce. When this stuff is released in the body, it kicks your production of red cells into overdrive. Now, y'all might remember me saying that we produce red cells at a rate of 2 million per second, every second that you're alive. When erythropoietin is produced, it doubles that rate to 4 million per second. That's going to happen when you've experienced some blood loss. The kidneys will release erythropoietin, kick the bone marrow into overdrive, and boom, you start producing double the amount of red cells. So that's what erythropoietin does, and have that for your notes. Erythropoietin doubles the rate of erythrocyte production, and again, not being released from our kidneys. The other substance released from the kidneys also helps to regulate our blood pressure. That stuff is called renin. Now, yesterday, you might remember me saying we had that picture of the glass of water that was half empty, and we said we needed to get the volume up here. And one of the ways we can do that was to decrease the size of this container, make the container smaller, and that will push the fluid level all the way up to the top. That's what renin does for us. It makes our container smaller by causing vasoconstriction. Remember the word constriction, to bring down tight. So if all of your blood vessels are open like this, then your container is that size, the body. If we constrict those down, we can decrease the size of the container, thereby increasing your blood pressure. So both those substances released from the kidney directed at blood pressure regulation. If you lose a lot of red cells, erythropoietin is released to double the rate to replace the ones you've lost. If your blood pressure is down, renin can be released to cause vasoconstriction, make your container smaller, and push your blood pressure back up to what you need it to be for a short period of time until we can get more fluid in you. All right. So these medications will almost always accompany high blood pressure meds. Um, a couple words that we threw in here last time just to make sure that you have heard them before. Diuresis means to urinate. So a medication called a diuretic is a medication that's going to make you pee. It's what we call the water pill. The most common diuretic out there is called furosemide, and the most common brand name for furosemide is Lasix. So anytime you've got too much water in your body, the doctor's going to put you on the water pill to get that excess water out of you. If you have high blood pressure, if you have congestive heart failure, where you're collecting water in your lungs and in your legs, we're going to put you on the water pill. If your liver shuts down and you develop ascites, remember the swelling of the stomach because all that fluid was trapped in there, or the swelling of the abdomen because they had all that fluid trapped in there, we're going to put you on Lasix to help you pee off as much of that fluid as possible. Y'all might remember that from Mr. Lefebvre, the guy I was talking about that had the ascites. So anytime you got too much water in your body, doctor's going to put you on Lasix to pee out some of that extra water. All right, and that's what a diuretic medication is. And these two will almost always go hand in hand, the blood pressure meds and the diuretic. All right, so know those two for your testing, erythropoietin and renin, and what they do. Now, the kidneys are located in a space called retroperitoneal. I'm going to move that up here. Retroperitoneal. Retro means behind, and the peritoneum is the abdominal area. So these are located behind the abdomen. They're not in the same space as your stomach, liver, and all the abdominal organs we talked about. They're located behind those. So that's the space where the kidneys are located, retroperitoneal space. And you should probably know the spelling for that one. A sample test question, which of the following is the correct spelling for the space where the kidneys are located? Retroperitoneal. Break those words down. And for those of you that haven't done it with me yet, next module we'll get some practice in breaking down medical terms into their component parts. Retro, behind, peri, around, toneum, the abdomen. The space behind or around the abdomen. Located right back, I can't stand up to show y'all because I got my shorts on. But anyway, right back, yeah, we can try and see. Right back here, on both sides. You might remember the lady from the digestive system where she was turned sideways, and I showed you that her kidney had dropped out of place. So retroperitoneal is the space where the kidneys are located. And you should probably pay attention to the spelling of that. Again, break it down. Retro, you can spell retro. Peri, you can spell peri. Toneal, okay? Tone, A-L. You can spell retro, you can spell peri, you can spell tone. A-L on the end, retroperitoneal. Break the words down like that, and spelling won't be a big deal for you. And pronouncing them won't be a big deal either, because you can say retro, you can say peri, you can say tone. All right, so that's the space where the kidneys are located, retroperitoneal, technically behind the abdomen. We just did those. Okay, wait a minute, I want to see something here. I want to move these up here. Put them after. All right. So we've talked about those two substances, erythropoietin and renin, the space where the kidneys are located. Make this flow a little bit better. And then what are electrolytes? Okay, electrolytes are fluids that have an electrical balance or electrical charge. So let me tell you why I changed this up a little bit. 3 purposes of the kidneys: to eliminate liquid waste, to regulate our electrolyte balance, and to regulate our blood pressure. We've talked about regulating the blood pressure. Now we'll talk about the electrolyte balance and then the eliminating liquid waste. So I kind of want it to flow like that. All right. So electrolyte is a fluid that has an electrical charge, either positive or negative. But either way, it has a charge to it. All right. And the reason we need to know what electrolytes are, or their periodic table symbol for electrolytes, is because this is the way the doctors will refer to them, or people around you will refer to electrolytes like this. We won't say the word potassium. We'll use the symbol K. Mahone, go ahead and give them a liter of K. Got it. And they expect you to know what that is. Right. And the ones that are most commonly referred to by their periodic table symbol are potassium, calcium, and sodium. Okay. So potassium is the periodic table symbol K. Now, these electrolytes, what do? 3 of them are essential for muscle function. And the other 2, well, I'm going to do these separate, are essential in our digestive system. Chloride we use to create acid. Hence the hydrochloric acid of the stomach. Hydro meaning water. So you suspend chloride in water, it creates acid. Hydrochloric acid. Okay. So we use chloride to create acid. We use sodium bicarbonate to neutralize acid. Okay. If you remember when we talked about the digestive system, we mentioned that one of the best ways to neutralize acid in your stomach is to take Arm & Hammer baking soda, which is sodium chloride. So we use those 2 in our digestive system. When we do the muscles, we'll talk about each one of these electrolytes, but just for knowledge right now, potassium is used for muscle relaxation, and sodium and calcium are both used for muscle contraction. Potassium to relax, calcium and sodium to contract. So when I do this, that requires calcium and sodium. When I'm ready to relax it now, that requires potassium. And that's why if your potassium levels are low, what might you be getting a lot of?
Potassium.
What if your potassium is low? What's going to be happening in your body? Go ahead. Somebody was saying.
Energy loss.
Good guess.
Muscle spasms.
Muscle spasms. Muscle cramps. A muscle cramp is when a muscle has fired and it will not relax until you get enough potassium there. That muscle's going to cramp. Oh, what's going on? Oh, man, I got muscle cramp. Oh, your body's waiting for enough potassium to get there for you to relax that muscle. And that's why it's so essential that the kidneys be able to release the excess potassium, but keep the sodium and calcium. That's important because potassium is a very strong muscle relaxant. And if this stuff builds up in your body, your muscles will start to relax on you, even the muscle of the heart. As a matter of fact, did y'all know that when we do lethal injection, the 3rd injection, the one that actually kills the person, is potassium chloride. And it's a way that healthcare people tend to commit suicide because potassium is readily available. You just walk in the IV room, get a liter of potassium, put it in your bag. A liter is the big IV bag. So that long IV bag, the biggest one we have, that's a liter. Just take one of those, put it in your bag, and take it home.
But that stuff burns going in you.
Yes, it does.
Because I had to get like two bags of that.
Was that, were you in the hospital going to have surgery tomorrow?
Yeah.
Okay. We're going to give potassium anytime we've got to cut through somebody's muscles in surgery. We're going to make sure the potassium is okay because we don't want to be cutting through muscle and having muscle cramp while we're doing it. So we want all their muscles nice and relaxed when we do surgery if we got to cut through a muscle. And in most surgeries, you're going to have to cut through muscle because you're going to have to get through the outer muscle of the body into the tissue, especially if you're doing something in the abdomen or the chest.
Yeah.
So we're going to make sure your potassium level is okay before we do that surgery on you in the morning. And that's what they did, the same thing to me when I was scheduled for my heart surgery in the morning. They came in that night and hung a liter of potassium. And yeah, it does burn going in. And that kind of gives us another kind of off subject, but it's a lesson for us. I woke up in the middle of the night, y'all. It was about 3 o'clock in the morning, and my arm was burning like crazy in the hospital. I mean, just felt like it was on fire. Now, that's also a sign that your IV line, this is a blood vessel, this is the IV needle. If it comes out of the blood vessel and the fluid starts to leak into the tissue, that's called infiltrated. Your IV is infiltrated. It's going to burn. So when I hit the call button and called the nurse, I said, hey, I think my IV is infiltrated because my arm is burning. Oh, no, I came in and gave you some potassium while you were asleep. Bitch, have you lost your damn mind? You hung a medication on a patient and you didn't tell them? You didn't wake them up and say, Mr. Mahone, I'm going to be hanging your IV for potassium now. It's going to burn as it's going in. That's normal. It's supposed to be that way. That's what you do. You give somebody a damn medication. You don't let somebody wake up in the middle of the night with their arm burning, calling you. And you know what she said? Well, I didn't want to wake you up. And you know what I said? Well, I'm up now, ain't I? Dumbass. Wake a person up, guys. Mr. Mahone or Sergeant Mahone, I'm getting ready to hang your potassium. It's going to make your arm burn a little bit. Don't just go hanging shit on people. Anyway, so what kind of nurse you going to be? All right, so that is our electrolytes. And oh, by the way, what do you do with that potassium when you take it home? You take the IV line, you put it in your rectum, open it up, let it run. No needle, just insert the tube. And the blood vessels in the rectum will absorb all the potassium that will make its way to your heart. And first, you're going to find it really difficult to lift your arms and that kind of stuff. And then it'll make its way to your heart. Your heart will seize and you'll die. So that's a very, very strong muscle relaxant. And that's why our kidneys have to be able to let this stuff get out of your body, right through your urinary tract. But then at the same time, making sure these two remain in the system. So the kidneys have the ability to determine the electrolytes that are in the fluid and filter those out and keep those. All right, so those are electrolytes and what they do for us. Potassium for relaxation, calcium and sodium for muscle contraction, chloride to create acid, and sodium bicarbonate to neutralize acid. Okay. All right. So anyway, those are our electrolytes. The one that's on your test is potassium. All right. Now the kidneys are redundant. What does that mean? Actually, this slide should be moved as well. Let me see. Both of these should be moved because I want to talk all about the kidneys first and then get into what they do. So let's move this one up here. It shouldn't affect you. Everything is still there. I'm not changing any of the reds or anything. Blood pressure regulation. And then it's the space. Renal pyramid. I just moved the wrong one. Undo that. This is what I need to move. This right here, blood pressure regulation. Redundant. Purpose. Let's move this one up here under purpose. And then I'll move this one up to undo that. Okay. Just kind of help it flow a little bit better. All right, so the kidneys are redundant. What does that mean? It means they do the same thing. Now, just because you have two of something, does that mean that they do the same thing? For example, you have two eyes. So are your eyes redundant? Do they do the same thing? What do you think? Are the eyes redundant?
No, because you have different areas that you got to see. So that one eye is working on this area and focusing on color, and the other one might be like focusing on something else, isn't it?
Okay. Real close, but a little bit simpler. The right eye picks up vision from the right side of the body, and the left eye picks up vision from the left side of the body. So if you lose your left eye, is there going to be any change in your vision? Yes, you can't see what's over here on the left side. So the eyes are not redundant, but the kidneys don't work that way. It's not like the right kidney filters the right side of the body, the left kidney filters the left side. They don't work that way. So if you take a person's kidney out, it's not going to affect their function a whole lot. Less than people would actually think. They won't be producing half as much urine, if you will. The person, if you do a kidney transplant between two people, the person that's receiving the kidney are going to have way more lifestyle changes than the person that's donating the kidney. The body just adapts to, filtration with one kidney filtering everything for you. So the kidneys are redundant in that sense. They do the same thing. So as a result, take one out, it doesn't affect your body a whole lot. And because of that, the kidneys are the most transplanted organ ever. We plants transplant more kidneys than anything else. And the reason for that is that you can donate one while still living. So you can't donate organs like that. Your lungs are redundant. So I don't know if they do very many living lung transplants where you take a lung out of somebody, transplant it to somebody else. I don't know, because the lungs are redundant as well. You can live with one lung. And we didn't mention that yesterday, but yeah, you can live with one lung. There's going to be some lifestyle changes, like you're not going to be running marathons, but you can live with one lung. Does anybody know a famous actor who had one lung? Y'all probably don't even know this guy, or you just know him from anecdotal stories from your parents or whatever. John Wayne, the Duke, had one lung. And that's why in later movies, you didn't see all the horse riding, jumping from horses and all that mess. It was more like draw down on you on the street, that kind of stuff. So it wasn't a whole lot of athletics in the later part of his career because he only had one lung. Now, because of have y'all heard of I think I mentioned it during the lesson, the living liver donation, where they take a liver, cut it in half, and you can give half your liver to somebody. That's really exciting because back in the day, or just even today in many cases, you can't donate a liver unless you're dead. But now they are pioneering living liver donations. So livers may catch up with kidneys as far as transplantation goes, or donating a part of your liver. But kidneys, since you have two, they are redundant, are the most transplanted organs out there. Now, and that brings us to the fact that you cannot sell an organ in the United States, but you can in other countries. So if you need a kidney and you can't get on the waiting list in the United States, you go to another country and you buy one for $40,000. Is the going price. And you see all these, there was another image of all these guys just standing there showing that they've all donated or sold kidneys. All these people have sold kidneys. So, you know, and we tend to think about, you know, well, oh man, how could you do something like that? How could these people just sell their organs? And we start to make, you know, moral judgments about these folks. But let me ask you, would you sell a kidney for $40,000?
Yep, I
Right.
would. I would. Yep.
Yeah, sure would. I wouldn't. I mean, come on, y'all. $40,000. See, there's what I call life-changing money. $40,000 is not life-changing money when you think about it. Okay. Now, if it's going to pay your way through school or something, maybe. But you're talking about what, a car? You know, about equal to the price of a car, $40,000 when you include all the insurance, all the interest and all that. You're talking about $40,000, and that's just not going to change my life that much. Yeah, it'd be nice to have, but I'm not going to be living in a big mansion, you know, retired for the rest of my life driving Mercedes Benz either. But for these people, yeah. When you consider that where they live, the average income is about $1,000 to $2,000 a year, yeah, $40,000 is life-changing money for them. So we can't make a moral judgment like that. Now I ask you this: would you sell a kidney for $4 million? Oh hell yeah! That's life-changing money. That's retired, living on 5 acres out there in the hill country, That doesn't change your whole damn life. Yeah, I would sell a kidney for $4 million. Matter of fact, I'd sell them both and just go on dialysis for the rest of my life because I can afford it now. Give me $8 million. Now I'm good. But yes, I'd sell a kidney for $4 million. And if you ask most people in the United States, I bet you money, most of them would go, yeah. And those that don't say yes will even think about it before they say no. It's not an automatic no. It's like, well, oh man, that's tempting. Hell yeah, it is. Just like 40,000 is tempting to these people. They could live their whole life on that money and still leave some for their children. So $40,000 is life-changing for them, just like $4 million is life-changing for you. So we can't extend our morals to other parts of the world like we tend to do. Has anybody been overseas? And I'm not talking about Mexico or out of the country. I'm not talking about Mexico or Canada. I'm talking about, have you ever been to Europe, Italy, Japan, China, any of those places? If you do, you're going to find that we have a reputation around the world, Americans. And it's not a good reputation. In most places, they would refer to you as the ugly American. Not ugly appearance, but ugly attitude. The ugly American. You come over there trying to tell them what to do and how to do it. We come from such a great place, and our morals are so much higher than everybody else. You know, you're up there on your pedestal, and you're just above everybody else. That's the reputation we have around the world. So we can't be extending that to, everything we see out there in other countries and so on. So anyway, that is why the black market is so big in other countries, because people can live after donating a kidney and live a fairly normal life. So the kidneys are redundant. They do the same thing. Now the kidneys are bean shaped. And the actual shape, or the kidney, came before the bean. When people looked at kidney, no, I know the bean came before the kidney. When people looked at the kidneys, they said they looked like beans. And that's where they get that term kidney beans from, because they're shaped like the kidneys. Okay, and this indentation right there, the part where it dips in and makes it a bean shape instead of oval, is called the hilum. The hilum is described at the indentation on the medial surface of the kidney. Now, what do we mean by that? Let's look at the textbook. Bring that up some. Medial means towards the middle. And you'll see that both of these kidneys have their indentation towards the middle of the body. So that's why we call this side the medial surface. It points towards the middle. This surface out here points towards the side. That would make it the lateral surface. So the indentation is on the medial surface of the kidney. And that's where all the attachments are to the kidneys. You can see in this illustration that the part that flows down to their kidney or to their bladder is attached at the hilum. But so is the artery that comes off of their aorta, also attaches at the hilum. And the vein that flows out to the vena cava is also attached at the hilum. And the vena cava going back up to your heart. So all the attachments are happening at the hilum, not just the tube that goes down to the kidneys, but also the renal artery and renal vein going to the kidney. Renal artery coming off of the aorta, the renal vein going to the vena cava to carry blood back up to the heart. So all those attachments happen at the hilum, the renal artery, renal vein, and this tube we'll be naming it a little bit later. It's called the ureters. So they all attach at the hilum. And that's why it's worth talking about that part, the part where all the attachments happen. The ureter coming off and down your renal artery flowing into the kidney for the blood to be filtered, and then your renal vein flowing out of the kidney. All those attachments happening at the hilum. So know the hilum as the indentation on the medial surface of the kidney. Your hilum. That's where all the attachments are. Now, back in the textbook, I want to go down to whatever page, this page right here. This is page 529. And you see the text up here associated with what we're getting ready to talk about. And that is that our kidneys are constructed out of two different types of tissue. Get a different color. Let's use black while we do this. Okay. This is one type of tissue you see right here. And you see there are several of them in the kidney. Those structures are known as your renal pyramids because they're pyramid shaped. Okay. And the renal pyramids make up the area of the kidney that we call the renal medulla. If you remember from the brain, whenever an organ has two types of tissue, the inner tissue is called the medulla, the outer tissue is called your cortex. So the cortex is all this stuff out here, all the way around. That's your cortex. And then the medulla is all of this tissue. So you see the cortex on the outside, the medulla on the inside. And the renal pyramids are contained within the medulla. And that gives us that slide, the renal cortex, the outer tissue, and the renal medulla. The renal cortex is where we produce those two substances we've talked about already, renin and erythropoietin, are produced in the renal cortex, that outer tissue. And then the inner tissue has the renal pyramids, like we've mentioned. And that's where filtration happens. So all out here is producing erythropoietin and renin, putting that into the bloodstream for you. And over here, filtration inside those pyramids. So giving us our two different types of tissue, the renal cortex, that outer tissue, the renal medulla, all of the inner tissue. All right. So those are the two types of tissue in our kidneys: renal cortex, renal medulla, outer tissue, inner tissue. We've done what those two do. We've done the electrolytes. Pyelo is a word part we need to discuss. It refers to a specific part of the kidney. Turn my heater off because it's starting to get hot. A specific part of the kidney, and let's look here and see where it is right here. That area being referred to as the renal pelvis. And the root word for that is pyelo. It should be over here somewhere. Right there. No, it's pelvo. I don't have that over here. Maybe it's up higher. Did I do that? Doggone it. Oh, man. And that moved me, I don't know, 10 damn pages back now. What a pain. Remember I said computers supposed to make our life easier. If I had a paper book in front of me, I would have been on the damn page by now. If you try to click over there, it's going to jump 70 damn pages in one click. Oh, come on. Jeez. All right. The renal pelvis. All right. So why does this word have its own, or why does this section have its own root word? Because we need to sometimes be able to refer to just that part instead of the entire kidney. So remember, nephro is kidney, but we want to say that part of the kidney, and that's pyelo. An example of that is somebody who has a condition of pyelitis. They have an infection right there. And it happens a lot, or not a lot, but it happens because as you filter and you bring all this gunk into that area of the kidney, it's more likely to develop infection right there. So we need to be able to refer to that part all by itself. So they assigned it the root word pyelo, so that we can say the person has pyelitis. But you could also have nephropyelitis, infection of everything. The kidney and the renal pelvis are both infected. You have nephropyelitis. So you can have nephritis, pyelitis, or nephropyelitis, infection of both. So pyelo simply gives us the ability to refer to that part of the kidney all by itself, the renal pelvis with pyelitis. All right. So that's why we use that word part pyelo, referring to just that area where urine is collected as it's made by the kidneys. Pyelo. It's the term pyelitis. So we've done blood pressure regulation, electrolytes as well. So now let's look at the renal pyramids and what they do. The renal pyramid structures in there, as a reminder, that right there. They contain a specialized type of cell in here. And in the kidneys, about 3 million in each kidney. So there are a whole bunch of these, all located in the renal pyramids. And those cells are called nephrons. And you see the kidney word part in there, nephron. So nephrons. These are the functional units of the kidneys. Remember we used that term yesterday when we said that the alveoli were the functional units of the lungs, because that's where the gas exchange happens. Since the kidneys are associated with filtration, the nephrons are the functional units because that's where filtration happens. They're responsible for filtering the blood and taking out all of the abnormal products in there, the stuff that shouldn't be there. All right, so I just looked up at the clock, so before we go any further, let's do this part. And today is the 11th. Getting closer and closer, y'all. So what's happening Friday?
Birthday.
Your birthday.
Oh, it's somebody's
Your
birthday
birthday.
Friday. Oh, okay. I'm just saying. I do that to my wife every day too. What's happening Friday? Does somebody have a birthday coming up soon? You leave me alone. You know that you already got your birthday stuff, and I did, but I want something else too. All right. So anyway, where's Nicole? There she is. Jordan Carter. There you are. About Yordell is here, right? Right. Yeah. Okay. Always. Miss Chestnut is here. Did y'all get that this morning? Mr. Mahone, this is Miss Chestnut. All right, then. Psh, all right, girl, you go, girl. Like Mr. T. Where's Renisha? There you are. How about Christopher is here? I saw Christopher. Oh, there you go. Cheryl is here, and Cassie. It's not here yet. Jennifer Green, did I see you? Where's Jennifer?
Mr. Mahone,
Yes.
my phone keeps cutting in and out.
Okay.
I'm here, sir.
Oh, I see you. Okay. Yeah, Chris, do what you have to. Elena Guzman, where is she? There you are. How about Davion is here. Isaac is here. Jaime. Where's Jaime? I thought I saw him this morning. Okay, not yet. Jasmine is here. Linda is here. Melissa. Tatiana is here. Maria Martinez. There you are. Vanessa Pargas. Vanessa, there you go. Selena Puente. Selena. Do I see you anywhere? Not yet. There. Sarah is here. Alma is here. Esther, are you here? Esther Torres, there you are. Crystal Trevino. Is Crystal here? Where's Crystal? Crystal. I don't see Crystal. Crystal, you here? Oh, there you are.
I'm here, Mr. Mahone.
Okay, and then Savannah. Where's Savannah? Wilburn. Where? Oh, there you are. Okay. All right, so let's go back to here. Message to. Is, Cassie Garcia.
I'm sorry, Mr. Mahone. I'm here. This Miss Chestnut.
I heard you. Okay, I'm just saying.
Okay, I'll just let you know I'm trying to log my kids on for school today. So I'm sorry.
Okay. All right. I was making fun of you a minute ago. Cassie, and then Jaime. I swore I saw him earlier. And then, of course, Daniel. Reed. And Fuente. Right. So Cassie Garcia, Jaime, or Selena? Going once, going twice. Sent. All right. And I'm getting homework from folks too. All right. So anyway, that is the nephron. Now the nephron is going to have specific parts to it. In the textbook, there is an image, but on the whiteboard, I'm going to simplify this image a little bit. And the image appears way the hell down here. Okay, page 532. Okay. And you can see the illustration of a nephron. Okay. Now I'm going to simplify this because I know this looks kind of busy. Okay. So on the whiteboard, let's go ahead and create the blood flow into the kidney, coming off of your aorta. Remember the aorta, the largest artery in our body, flowing down from our heart being up here. The aorta flows down and a branch goes off over into both kidneys, being your renal artery, carrying blood into the kidneys. All right. Now that's going to break into smaller and smaller branches until they are tiny, tiny branches. So for the sake of space, coming out into these tiny, tiny branches like that. Breaking down, and each one of these attached to a nephron. Okay. And that's about the size they would be, even smaller than that. Okay. So you've got your small branch coming in, getting into the first part of the nephron that's going to catch all the blood that flows in there. Kind of like that. All right. So as the blood flows in, it gets caught in this capsule right there. That capsule is called your Bowman capsule. And remember how small these are, about 3 million in each kidney. So these things are tiny, tiny. The Bowman capsule is also called glomerular capsule because it contains a structure called the glomerulus. And I don't know why I'm doing that so small. Remember, these things are small. Okay. So your glomerular capsule, and then the entering blood vessel on this side. The Bowman capsule contains a filter in there called the glomerulus. That's why it's sometimes called the glomerular capsule, because it holds the glomerulus in there. Again, that's pronounced glomerulus, glomerulus. And the glomerulus has small openings like this. These openings are bigger than I want to make them, but there you go. So that as things flow in here, anything that's too large to pass through those openings gets redirected to blood flow. The stuff that's small enough will pass through and become part of urine. So that's the filtration. Small stuff passes through, big stuff gets returned to circulation. Now, what examples of big stuff? Blood cells, proteins, those should all be returning to blood flow. And then the stuff that's passing through here is all waste product. And that's how filtration happens. Big stuff gets returned, little stuff passes through. And you've got 3 million of these in each kidney, filtering that little stuff out for you. All right, so that part of the nephron, the two parts of the nephron are the Bowman capsule and the glomerulus. So I want to, let's take all this out for a minute and let's clear a couple things up. Okay. The nephron has two main parts. the renal corpuscle, and the renal tubules. The renal corpuscle has two parts, the Bowman capsule and the glomerulus. So we've named the two parts of the renal corpuscle, the Bowman capsule and the glomerulus. So after everything is filtered inside the Bowman capsule and glomerulus, the waste product is carried out into the second part, called the renal tubules. So the illustration in the textbook might help this seem a little more understandable. That's your glomerulus or your renal corpuscle right there. And inside, shadowy kind of, you can see in there the glomerulus in there. So the green is the Bowman capsule, also called the glomerular capsule. And inside the blue is your glomerulus, with one blood vessel flowing in, the other blood vessel flowing out. And everything that's small enough will be filtered now and passes its way out into the tubes or tubules, the tubules. So that's showing your renal corpuscle over here, and on that side, the renal tubules. The renal corpuscle contains the Bowman capsule and the glomerulus. I wasn't trying to line that out. I was trying to underline that. The Bowman capsule and the glomerulus, part of the renal tubule or renal corpuscle. And on the other side, the renal tubules. Now you see that the renal tubules do not go a straight route. They kind of wiggle all over the place. Because of that non-direct route, they are referred to as being convoluted. Convoluted. Now, what that means is that it's not taking a direct route. So somebody might tell you, if you get in an argument with somebody, they might tell you that your point or your argument is convoluted. What are they saying about your argument? It's all over the freaking road, man. It doesn't take a straight point, or you're not making a point. You're just all over the freaking place. So convoluted means just kind of all over the place. And you see that these tubes are just kind of all over the place. So when I illustrate them in my PowerPoint or on the whiteboard, I usually just do a straight tube. But know that they do go all over the place like that. They are convoluted. So that gives us the parts of the nephron. And let's go to PowerPoint real quick. Are there any questions in that? Yes, the two parts of the renal corpuscle. The two parts of the renal corpuscle are the Bowman capsule and the glomerulus. And that's your nephron, the renal corpuscle and the renal tubules. The two parts of the renal corpuscle, Bowman capsule and glomerulus. And they attach to the renal tubules. And I think the next slide mentions convoluted. They're all over the place. And also notice from the illustration in the text that there are blood vessels wrapped around the tubules. Those blood vessels are called your peritubular capillaries. Peri means around. So capillaries that are around the tubes, peritubular. So those parts, those blood vessels right here, wrapped all around the tubes. And when we come back from break, we'll talk about what those bad boys do. All right, so it is about 10 after. Let's take 15 minutes because I really do have a headache right now. Let's come back at 9:25. Gives us 15 minutes. Okay, I'm back. I had to sit out in the front yard watching my dog stalking a squirrel. And that's my dog, Rocky. 1,000 squirrels chased, 0 caught. Anyway, he's just stalking like, ooh, ooh, squirrel, ooh, ooh, ooh. I just go because you're not going to catch the thing. He never does. So that is the parts with your glomerular or Bowman capsule and glomerulus, both being part of the renal corpuscle. And then the renal tubules are convoluted. They're all over the place like that. So when I illustrate it, I usually do your renal corpuscle and then your renal tubules for simplifying. With your peritubular capillaries wrapped around, pulling over back to blood flow. Okay. So how can we illustrate this? All right. So from your glomerulus, all that stuff that's small enough to filter through will end up in the tubules over there. And everything that's too large, blood cells, proteins, will return to blood flow. So what you have in the tubules is all waste product. However, you're going to get in there sometimes large proteins. Proteins should be returned to blood flow. So that's what the peritubular capillaries do. They pull all these little proteins out and return them to blood flow. So by the time you get over here, all you have are the greens, all the blues have been pulled out. However, the peritubular capillaries will also add the reds. What are the reds? These things are coming straight from your liver, and they're the result of metabolism. So everything that your liver is breaking down for you also gets put into the urine by the peritubular capillaries. So what types of stuff are the reds? Any medications that you're taking, any drugs that you're taking are the reds. So the greens are byproducts from the bloodstream. The reds are byproducts from the liver. They both come together over at the end over here to create urine. The blues get pulled out, the greens continue, the reds get added. So by the time you get over here, you got the reds and greens. All the blues have been pulled out. The greens are the byproducts from our urine, from our blood. The reds are the byproducts from our liver. They come together to create 1 drop of urine. Hey, so all of that to create 1 drop of urine. The big stuff gets pulled out. The waste products continue. The useful blues are pulled out. The reds are added, and you end up with 1 drop of urine on the other side. But remember, there are about 3 million of these in every kidney. So there you have it. 3 million drops of urine or 6 million drops of urine creates the urine that actually fills your bladder. So if you look in the back and forth on the doggone pages again, in here, every one of those dots is creating 1 drop of urine. And those drops of urine get collected all in the renal pelvis. They come together from all directions to flow down towards your bladder now. So it's now urine. So those are the parts: the convoluted tubules and the peritubular capillaries, the renal corpuscle, the renal tubules, filtering, pulling out all the bad stuff, adding the stuff that comes from our liver to create that one drop of urine. So when we are detecting, cocaine, pot, heroin, or morphine, it's showing up as the reds. So that's where it comes from, directly from our liver, the reds. So that's why one of the most common lab tests we do on people is the urine sample. We do more urine than blood. The doctor always wants, let's get a urine sample. Sometimes, let me tell you why they're doing that. One, we can determine a lot in a person's urine, from what medications you're taking to drugs you're doing to whether your body is processing the waste product out of your blood or not. All of that is being detected in your urine. So now sometimes the doctor will come to you and say, hey, Mr. Mahone, or hey, you've been taking your blood pressure meds? And you go, yep, been taking them every day, doc, no problem. Yep, been taking my blood pressure meds. Okay, well, while you're here, let's go on and get a urine sample. Whenever a doctor tells you they want a urine sample right after they ask you if you've been taking your meds, what are they getting ready to do with that urine sample? They're ready to check to see if you've been taking your meds. Because if you have, they'll be able to detect them in your urine. And then they can come back and say, you haven't been taking your blood pressure meds. Oh, yes, I have, doc. No, you haven't. Because we're not seeing the byproduct of that medication in your urine. You have not been taking your blood pressure meds. So that's why one of the reasons that urine samples are the most common lab tests we do on people. Okay. One, they're easy to get. And two, we can tell all kinds of things about you from your urine. Okay, so that's what's happening inside the kidney, inside all those nephrons. The big stuff is being redirected. The waste product passes through. The peritubular capillaries pull out the little proteins that get through, and then they add the metabolic processes from our liver, creating that one drop of urine. All right, so where is all that urine headed? I'm glad you asked. From each kidney, are the tubes that carry all the urine from the kidney down to your bladder. One tube from each kidney. And those tubes are called the ureters. Some people pronounce them ureter. I prefer the pronunciation ureter. And in a minute, y'all will know why. So the ureters, the two tubes that carry the urine from the kidneys down to your bladder. Now, there can be a problem in the ureters. They're just tubes. They don't have any structures to them. I'm sure if you were a urologist, then yeah, you dissect the ureters and you would name the 3 layers inside the tube and all that mess. Because remember, anytime I said that something is hollow on the inside, you're going to have an inside layer, a middle layer, and an outside layer. So if you were a urologist, yeah, you would go through and you name these layers. But for us, that's just not important. Right now, it's just a tube that carries the urine down to your bladder for you. All those drops, 6 million capable from each kidney. All right. So now, the problem that can happen in the ureter is that somebody can, as we produce urine and go to direct it from your renal pelvis down the tube, as urine collects in this area, remember your pyramids being up here, creating all that urine for you. All of that collecting in this area. Urine tends to concentrate right here or get thicker. And as it does that over years, it can sometimes give rise to kidney stones. And you end up with a stone in your ureter right there. Now, if that stone is big enough to block the flow of urine, then the urine is going to start to back up into the kidney. And you're going to start to see something like this, with distension there at the tube because the urine can't flow out of there. And then the kidney swells up real big. That's called hydro because you're collecting water in there. Down here, hydroureter. This spot right there, hydroureter. Up here in the kidney, hydronephrosis. Water in the kidney, osis is condition. So you have hydronephrosis, condition of water backing up in the kidney. Kidney swells up real big like that. Okay? And this person is going to need a kidney transplant because they had a stone blocking their ureter. They had hydroureter, which progressed into hydronephrosis. All that water causing the kidney to swell up like that. And we'll do a kidney transplant for this person. All right, so that is a stone because urine that collects in this area tends to concentrate and can build up into stones. If that stone is so big it can't get through the ureter, it's going to block the kidney and the kidney is going to swell up like that with all this urine collecting in there. So all that is urine that should get into your bladder, but it's not getting there because it's blocked. All right. So that's usually the main issue that people have with their ureters. They get hydroureter because of stone blocked in there, and then that backs up into the kidney, causing hydronephrosis, and then the kidney becomes destroyed as a result. All right. So what's down here? The ureter, the tube that leads from the kidney to the bladder. There you go. And remember what I said, guys? I really don't even need these slides because I teach the same way every time, whether I know it's there or not. And there it is, hydroureter and hydronephrosis. The other thing you should take away from here is this term, nephro, kidney. Litho is stone. Nephrolith is a kidney stone. Kidney stone. Iasis, which also means condition. Have the condition of having kidney stones, the presence of kidney stones. I know why I have a headache now. I just realized what I did this morning. I used these glasses that my wife bought for me the other day. This is my first time using them and gave me a freaking headache. So anyway, I won't be using those anymore. So nephrolithiasis, the presence of kidney stones. All right, there's Jaime. Has anybody ever had kidney stones before?
None at all, sir.
No, you poor things. Okay, so I got Jaime. Anybody else? Is Cassie here? Cassie. No, I don't see Cassie. What about Selena? Selena, anywhere? Okay, no Selena. All right. Those are the only two I'm really looking for, is Cassie and Selena. Okay. All right. So that's why we get, or that's what kidney stones are. Nephrolithiasis is the presence of kidney stones. Now, I do want to go to the textbook again. I'm hesitating about this because it's all the way towards the back of the chapter. I got to scroll all the way down there to see it. Well, not towards the back, but pretty far. All right, there it is. Page 541. And on that page, you see this thing right here. And the reason I really want to look at this is because people often misunderstand stones. And most people, when you say stone, they think something like this, like a river stone. You got this smooth little thing floating through there. But you see that stones are quite jagged. And it has the lines going down to show you the actual size of the thing. So that's magnified so that you can see it. But remember, these are tiny things, man. But remember, the tubes are tiny as well. And if this thing passing through your ureters or your urethra is going to scratch and cut as it goes through there. So this is painful as hell passing one of these bad boys. I've seen grown men in tears trying to pass a damn kidney stone, okay, or a bladder stone. So you can see how it's going to scratch and cut as it passes through there. This is not something that's going to be smooth. This shit's going to hurt as it goes through your system. All right, so I just wanted to show you that image of the kidney stone. All right, and that is nephrolithiasis, the presence of kidney stones. All right. Wait a minute. That's the ureter. Where's the hell the urethra? Where the hell is the urethra? Okay, we go to the bladder next, my bad. All right, so let's go back here and look at each kidney with the tubes coming down your ureters, carrying urine down to your bladder.
Is it pertaining to? No, fine.
All right, so the bladder, the word we use for bladder is cysto. So as you have a condition like cystitis, remember, itis is the most common of our suffixes. Inflammation or infection of the bladder. Not too long ago, a few months back, I had a cystoscope, where they took a scope and looked inside my bladder, looking for bladder cancer. Okay, they didn't find any. All right, so anyway, that's how we use that word part, cysto, in cystitis or cystoscope, to look inside a person's bladder. All right, so the bladder can hold all of our urine, and that's what it does for us. It's like a bag that hangs there and holds your urine for you until you're ready to get to the bathroom. If it wasn't for the bladder, you'd be peeing all the time. All right, so the bladder can hold about 250 cc's of urine. When you look at that large IV bag, that 1 liter bag, that's 1,000 cc's. So about a quarter of the big IV bag can be held in your liver, in your bladder. Now, if you remember the stomach had a bunch of little folds in there that allowed the stomach to expand. Well, the bladder has the same thing. It has little folds that when the bladder is empty, it's all squished up. But when fluid rushes into it, it starts to swell. And the folds in there allow it to swell up to a certain size. So you can go above 250, but when it gets to 250 cc's, that's when you get the sensation of having to use the bathroom. And then you hold it past that, and the whole time, the bladder is just swelling and swelling, holding more fluid, but eventually you're going to have to get this stuff out of you. Okay. Now, one of the most common issues with the bladder is going to happen in women. And that's because when you get pregnant, you hold your baby right here. And you see what it does? It actually pushes down on the bladder. Something like that. And that's why pregnant women have to pee so much. I mean, I got to pee all the time. Yeah, because your bladder is decreased to about half in size with the baby pushing down on it the whole time they're in there. Okay. And the bigger the baby gets, the worse this is going to get. And you'll be peeing all the freaking time. So in your third trimester, it's almost like living in the bathroom. It's like, really have to pee again? Yeah, because the baby's pushing on the bladder. Now, the bladder is held in place by a set of ligaments that keeps it held upright like this. But over time, pushing against it with multiple pregnancies, these ligaments start to stretch. And what you end up with is something that looks like this. Instead of being held up, the bladder is actually sagging on both sides. It's called a sagging bladder. And you start to collect urine in these two parts that doesn't get emptied out. So as a result, that starts to fester in there, and you start to end up with bladder infections, with the urine just sitting there. It can't be emptied correctly. So the doctor might recommend a bladder sling. That's a wire mesh they put into your body that actually holds your bladder up like that, like these ligaments should be doing. But once a ligament is stretched, it doesn't go back to shape. So in your body, the ligaments are actually like that because they've been stretched down over the years. A bladder sling will help pull all this back up in place again so that you can empty the bladder the same way you can over there. So some ladies, especially after having multiple births, doctor might recommend a bladder sling so you don't get a lot of bladder infections. All right. So the other issue that might happen with the bladder is bladder stones, a stone that made its way from the ureter and actually did get down into the bladder. And it can sit in the bladder for however long until it's big enough to get trapped as it tries to get out of the bladder. So you can have bladder stones as well. Another, not common issue, but another issue that happens with the bladder is bladder cancer. And that's what they were checking me for. The reason they were checking me is that bladder cancer is the second most common cancer among smokers. And when they saw on my kidney, they did a CT scan and they saw what looked like a lump right there. So they couldn't really see what it was. So they decided to go and schedule me for a CT scan. I showed up for my CT scan so that they can see what this lump thing was on my kidney. And the guy checked me out. Mr. Mahone? Yeah, that's me. Come on back. We're going to do your CT. All right, here I am. Okay. He's got the little, looks like we're doing your bladder today. No, you're doing my kidneys. Oh, it says right here, bladder. I don't care what it says on that piece of paper. You're supposed to be doing my kidneys. So he calls up to the urology department, and they set him straight. And remember that thing, guys, about always having to have the last word when talking to somebody? Don't be that person. Because he walked his silly ass right back in there. Well, yeah, I guess it is the bladder, or I guess it is the kidneys. But remember that bladder cancer is the most common cancer among smokers, and I see you're a cancer patient, so, or I see you're a smoker, so it was a common or an understandable mistake. No, it wasn't an understandable mistake. In healthcare, there's no such thing as understandable. You made a damn mistake. Just say, sorry, I made a mistake. Don't come back in trying to justify the shit. All right, so they still couldn't see it well enough on the CT. So they decided well, okay, let's go on and do an MRI. So I'm back a few days later, a couple weeks later. Now I'm in the MRI department. Mr. Mahone, come on back. Time for your MRI. I see we're doing your bladder today. No, kidney. Oh. It says bladder right here. So I'm going through the same thing again with a different person. So what does he do? He calls up to urology. They said, no, you're supposed to be doing the kidney. And what do you think he said? Well, since you're a smoker, it's an understandable mistake. No. See, I don't like those technicians who just, healthcare people who just think they've got to have the last word with you. They've got to show you that this was not their mistake and that it's understandable. So anyway, here I am going back and forth with these damn people. They finally decided that it was a tumor. So they had to go in and do surgery to take it off. Luckily for me, it wasn't a malignant tumor. It was a benign tumor. So they just had to go and take the tumor off before it turned malignant. All right. So I didn't have the bladder cancer, but I did have tumor on my bladder. All right. Or my kidney. See, they got me saying it. So now I go in for the kidney surgery, and I wake up after the surgery. My wife wasn't in there with me, by the way, and I had a real problem with that. Where was she? She went out to get something to eat. You don't go get something to eat. What the hell's wrong with you? You're supposed to be in the room when I wake up. But anyway, I wake up and she wasn't there. So first of all, I'm like, I see, now I'm pissed. But then I start kind of exploring around, and I've got this really big bandage right here. Big bandage. And I reach around back, nothing. Big bandage right here, nothing around back. I know damn well they didn't do what I think they did. Because remember, every time I came in, it was, your bladder, your bladder. No. Did these bastards do something with my bladder? All up front, big bandage, around back, nothing. So I'm hitting the call button like, get your ass in here. All y'all, what the hell did y'all do to me? Well, they took a tumor off your kidney. What the hell is this? Oh, they didn't tell you? Tell me what? When they do kidneys, they don't go through the back, they go through the front. The reason is that the muscles of the back are so thick that if they cut through those muscles and they don't have to, it's going to cause a major recovery back there. So they go through the front instead. Go through, move everything out the way, find the kidney back there, do what they have to do, and then come out. Well, it would have been nice if my surgical team would have told me that. And when the surgeons came to visit me, we had that talk. You know, y'all should have said something about going in through the back. Oh, I thought we did. No. Y'all didn't say anything about going in through the front. Had me thinking. And then I told them the whole bladder story with the EKG, with the MRI and the CT scan, and everybody wanted to go around with my bladder. And then I wake up and there's a damn bandage on the front. They're like, oh yeah, I see how that would scare you a little bit. Hell yeah. So anyway, don't be that one out there who thinks you got to get the last word all the damn time. So that is a little bit about the bladder, holding up to about 250 cc's. Now, the bladder is held closed by two sphincters. Does that sound familiar to y'all? Two, one internal, one external. And remember that the internal is never voluntary, whether it's the rectal or the bladder. This is the one that opens automatically. And the external is the one that helps you hold it till you get to the bathroom. So the actual structures would look like this, with your bladder, your internal sphincter, and then your external sphincter. When the bladder is full, this sphincter opens, urine flows through it, puts pressure against the external, and that makes you feel like you have to go to the bathroom. And the external stays closed until you get to the bathroom, hopefully. You poor things. Now, I put space between these two because in men, there's an extra gland that sits right between the two sphincters. In women, the two sphincters are right on top of each other. So when the internal opens, the external gets pressure, and you hold it till you get to the bathroom and let everything out. But in men, they're separated a little bit with a gland right between them. The gland that sits between them is called our prostate gland. And we'll be covering that when we do the male reproductive system. It's a reproductive gland, but it's co-located with our urinary tract. And that's why reproduction is done by urology in men, because the prostate gland is co-located with the rest of the urinary system. So later on in men, we'll be talking about what that prostate gland does. However, right now we can say that one of the common issues with men is the enlarged prostate. Almost every male is going to have enlarged prostate as they get older. It's called benign, meaning not cancerous, prostatic, pertaining to the prostate gland, hypertrophy, excessive development. So the prostate's getting big. We call it BPH. Now, how does that affect the urinary issues, or how does that cause urinary issues in men when they have BPH, benign prostatic hypertrophy? Well, remember there's a tube passing through here. So when the prostate enlarges, it doesn't just swell out this way and get big. It also swells inside. And you see what happens now? Their urethra gets squeezed off. And pushing urine through there might be a little difficult for them. So this is a guy who is really pushing to empty the bladder. Now, you should be able to just kind of relax and everything just flows out. But for these folks, relaxing is not going to do it. They're going to have to push the urine through there. And it leads to what's called a spurty urination. So what's happening is when they urinate, well, when they urinate, kind of like that, what they get is psst, 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 instead of a steady flow. Where you should be getting everything just flowing out of there. These guys are, and they have to push the urine past the prostate. Also, They won't be peeing with force like this. It won't be coming out like nice and forceful. What'll be happening is it'll be dripping out of there. And if you ever go to that building over there where the school is, Chris and Isaac and Heine, downstairs on the first floor, there's an eye clinic down there. A lot of old men go into that eye clinic, and they go around the corner and they use the bathroom down there. That floor is always covered with piss. It's nasty. When you walk in there, you are literally standing in urine because those guys are standing there and they're peeing right on the damn floor because they stand back too far from the urinal and they pee, and it just dribbles out all down on their shoes, all down on the damn floor. And remember that they're there for the eye clinic, so they can't see shit anyway. So what we tell these guys is to stand up into the urinal, man. Don't stand back like when you were 20 years old, thinking you can go for distance and all this shit. Get up in the damn urinal. And if nothing else, use the damn toilet. But stop peeing all over the freaking floor. They can't see it, and it's just dribbling out. The other part is that as they take the penis out their fly, they let the penis rest on the fly of the trousers. And remember, the urethra comes up the underside of the penis. So they're also getting some squishing because of their trousers, squeezing the urethra a little bit. The prostate is very little force. So what are they doing? They're literally dripping all over the damn floor. So don't be surprised if you go into a bathroom and you see somebody standing at the urinal with their pants pulled down, so that they're not resting the penis over the fly like that, trying to urinate. So you might see butt, or somebody standing at the freaking urinal. Just that's why they're doing that. They're not trying to, entice you or anything. They're doing it because they're told to pull their pants down when they pee, or use the doggone toilet rather than trying to use the urinal. So that is the classic sign that somebody has an enlarged prostate. They lose urine force as they're peeing, and they can't get enough pressure through here, and the urine just dribbles out the end. Right, so that is benign prostatic hypertrophy, how it affects their urination. BPH also leads to bladder infections in men. Men usually don't get those. So if you have a 75-year-old or 55-year-old guy come in the clinic with a bladder infection, it's probably because of the enlarged prostate. And we usually don't do anything about it unless it just becomes a real issue for them. And every time I talk about the urinary system, I have to pee. Y'all give me 10 minutes. Got to go right now. Poor me. Okay, so that's what happens when males have an enlarged prostate. They tend to have trouble with urinary flow, and they tend to develop bladder infections sometimes. Okay. And tomorrow, when we do, or Thursday, when we do the reproductive system, we'll talk about the prostate gland and what it actually does or why it's there. All right. So now we need to get from the bladder to outside the body through a tube called the urethra. Remember, the tube that came down to the bladder was the ureter, one on each side, coming from each kidney, and then one urethra that leads outside the body. Now, in women, the urethra is about 1.5 inches long. So it's only about that long. Now, in men, the urethra can be between 8 to 10 inches, longer on some men than others. Okay, because it passes through the penis. So it's going to be long and be short on some dudes. So 8 inches to 10 inches long. Okay, so now, what this tube carries the urine outside the body. And from there, we expel urine. Now, in women, the urethra is located just above the vaginal canal. And in men, obviously, it passes through the penis, the underside of the penis. All right, now, so what happens to you when you are at work and you get that sensation, oh man, I gotta pee? The internal sphincter is open. The external sphincter is still closed. But you say, okay, well, I'll just hold it till I get home. So you drive home, no problem. You get to the driveway, you get out your car, you go up the steps to your apartment, whatever, no problem. But as soon as you get to the door and take out your key, all of a sudden, problem. You gotta pee right now. Why does that happen? Because the external sphincter stays closed until you relax. As soon as you relax, it opens and urine starts to move through there. When you get home, you get that, I don't know, almost everybody, when you get to the house, it's kind of like I'm home. So that's what you did when you took your car key out, your door key out. Oops, shit, now you have to pee. And in women, you got 1.5 inches to get to the bathroom because urine is moving. You got that far. So I always wait because my wife doesn't pee at work. So she comes home and every time she's got that far to get to the bathroom. So what I do is I stand in the downstairs bathroom, the one right by the door coming in, and I just stand there like I'm doing something and make her have to run upstairs and watch her do the pee dance all the way up the steps. Ooh, 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 ooh. Yeah, you need to start peeing at work, punk. But anyway, I'm not sitting on them nasty toilets and da 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 da. So when she has to, she hovers. I'm like, you hover, yeah, you just hover over the toilet. You don't put your butt down on it. I'm like, whatever, girl. So anyway, you should have been a boy. You should stand up. All right. So anyway, that is the urethra, the tube that carries urine outside the body. And I think that might be a test question as well. Let me see here. Yes, the urethra, the tube that leads from the bladder to outside the body. So, yeah, we did the prostate gland, BPH, and then the urethra, the tube that leads from the bladder to outside the body. 1.5 inches long in women, about 8 to 10 inches long in men. All right. So that is your urethra. So when you look at the entire system, kidneys, ureters, bladder, urethra. Kidney, ureter, bladder, urethra. 2 sphincters, 1 and 2. And there you go. The kidneys, ureter, bladder, urethra. Filtered, creates urine, stored in the bladder till about 250 cc's. Internal sphincter opens, you relax, external sphincter opens, and the urine flows out the urethra. Kidneys, ureter, bladder, and urethra. This word, pronounced voiding, it means to urinate. And then incontinence is the ability to control urine or fecal flow. The patient can be urinary incontinent or fecal incontinent. Okay. And the patient is referred to as being incontinent. Patient in room 7 was incontinent, which means you need to go in and change the bed. And for people who have incontinence, inability to control their urine flow, especially their urine flow, we're going to go on and give them Depends or Attends, the undergarments, and be kind of, I don't know, sensitive with these folks. Don't call these things diapers. I had a young lady do that once. Miss So-and-so, here's the prescription for your diapers. And I called the young lady down in my office, coming down here, talk to me for a minute. Diapers, really? These are grown-ass people, man. And there is some dignity here. And she's a young girl, just don't understand. There's some dignity here, okay? Please refer to them as either Depends, Attends, if you have to, undergarments. Why these 2 terms? Because these are brand names, companies that make them. The Depends or the Attends. Or if nothing else, again, here's a prescription for your undergarments, not freaking diapers. Here's a prescription for your diapers. You know, have a little bit of respect and sensitivity. All right. So anyway, that is the 2 terms that we use to refer to, or that's the term we use to refer to urinating. And, you know, I really don't, when somebody goes into a patient's room and go, have you voided today? Have I done what? Have you urinated or peed? Why didn't you just say that in the first place? Okay. So don't get hung up on these terms, guys, when talking to your clients. Yeah, have you voided today? Have I done what? Voided, you know, urinated. Well, thank you. Why didn't you just freaking say that? So anyway, sometimes speak to the terms that the patients understand. Don't get hung up in the medical jargon. So voiding means to urinate, and incontinence is inability to control urine or fecal flow. If you are in the hospital, they may just go ahead and put you on or put a catheter in place. All right. So it's down here. Enuresis, urinary tract infection. Okay, let's go ahead and put it here. Urinary catheter. Okay. Has anybody ever had a catheter, a urinary catheter? You might have had one while you were, you know, you got to deliver your little baby.
Yes.
Because you couldn't do it at home because y'all just wimpy.
They're uncomfortable.
Yes, they are uncomfortable.
Very.
Catheter. Now, here's the thing, Miss. Who said that, by the way? Who said it was uncomfortable?
Me, you're down.
Was that Yardell? Okay, let me tell you something. Yardell. All right. In women, 1.5 inches. In men, 8 to 10 freaking inches of catheter pushed up in there. Tell me what's uncomfortable. Psst, whatever. All right, so a catheter, for those of you that haven't had them, they're rubber tubes that go through your urethra into your bladder to have urine come out without you having to control it. It gets caught in a bag, and therefore you just constantly peeing while you're in the bed. That's the unusual part. To be laying in the bed, feeling urine leave your body, and you're laying in the freaking bed. That is just weird sensation. So what are we doing here? Your bladder with your urethra. We're inserting a rubber tube into the urethra all the way up into your bladder. And that tube then dumps urine into a container over here. So that's a straight cath. We put it in, empty the bladder, take it back out again. We only do it just to empty the bladder right now. Okay. For example, somebody who has to have a drug test and claim they can't pee. I don't know about the rest of the world out there, but in the military, you're going to pee before 4:30. If you don't, you do one or two things. You either admit guilt or you go down to the emergency room and have them catheterize you. But you're going to give us some urine today or admit guilt, one of the two. So we have them sitting up in there at 4:30, go, oh, I still can't pee. All right, well, either sign this form or go down to the emergency room, one of the two. So they usually go to the ER and get catheterized. Dip a catheter in there, empty their bladder one time, take the catheter out, you're done. The other type of catheter is one that's going to be in there for a while, 3 days. So that has a little balloon on the end that we inflate like this. And that anchors the catheter into the bladder, and it'll be there for 3 days. You change these every 72 hours. Now, as PCTs, one of your big issues for people that are on catheters, and you've got to make sure you are diligent about doing this, is you have to do catheter care. Clean right around the area where the catheter enters the body. Now, in women, urethra or a vaginal opening, catheter goes in right there. You need to do AM catheter care right around that area. Because imagine the amount of bacteria and stuff that's going to build up right there while that catheter is in there. And in men, the tip of the penis, right where the catheter goes in, doing your catheter care right around that area. Ensuring that they're not getting bacteria into the urethra in either scenario. So your AM catheter care is very important because the most common cause of infection in people in the hospital is catheters. A lot of people jump right on the IVs. IVs are number 2. Number 1, catheters. These things are going to sit in there for 3 days. And by the way, we also change IVs every 3 days as well. Okay. So that is your urinary catheter going into the bladder, either anchored in place because it's going to stay for 72 hours, or we go in, empty it, and pull it right back out again for somebody that needs a urine sample, like a 1-year-old. Doctor needs a urine sample from a 1-year-old. How are you going to get that? They could give you that little thing, that bag thing. Y'all might have seen it before. It has adhesive to it. You stick it around the genitals, so when the baby pees, it all gets caught in the bag. But that's dependent on the baby actually peeing. Plus, it's adhesive. So what do you think is going to happen as soon as the baby starts peeing? The damn thing's going to come off. They're horrible, y'all. So in the ER, we catheterize to get the urine samples that we need. So that's what a catheter is. One that's either indwelling or a straight cath. We go in and take it right back out again. And let's find an image of one. And I'm going to search Foley catheter. Foley is the most common brand name for indwelling catheters. And there they are. This is the balloon that gets inflated, that anchors it in place. This is the tube on the side where you attach the syringe to inflate the balloon. And urine actually flows out of this part right here. This is where the bag will be attached, so the urine constantly flows out into that bag. When you need to take this out, you put the syringe back on this end, you pull all that fluid out, and you take the catheter straight out. PCTs usually won't get involved in catheterizing patients, but you might be the one that goes in and DCs the catheter. In other words, takes it out. And this is the urine bag. So this end of the tube attaches to the other end of the catheter that we were looking at. Right there. Just plugs right in there. And also, daily, you'll go in and on the graduation right here, you'll tell right in their record how much urine is actually flowing into their bag. This part right here unlocks, flips down, push this blue part in, and all the urine flows out of the bag into whatever container you're catching it in. So emptying these will be a common job for PCTs. Go to the bed. This will usually be hanging on the side of the bed by those clips. Record how much is in it. Put your container underneath. Flip this down. Push this blue button in. And all the urine flows out into your container. Empty it. Plug that back in. Come back whenever you need to. This is a whole catheterization kit. So there you see your gloves, your drapes, everything you need to clean the patient right here in this pouch. So you open that up. They're usually a couple of big, what look like big Q-tips, man. Big red, reddish brown on the end. You take that and you clean around the urethral meatus, the urethra itself. The lubricant is also in the kit. You lubricate the tube and slide it down into the urethra. When you get to one part, you'll feel a little bit of pressure. That's the sphincter. Give it a push and it pops through the sphincter. Once in place, attach your syringe on the side and inflate the balloon. Give it a tug, make sure it doesn't come back out again. In 3 days, you go in, deflate that balloon, take this out, replace it with another catheter. So that's the whole kit right there. It usually comes pre-packaged. Open it up and everything you need is inside there. And the catheters come in different sizes. The size is referred to as FR, which is short for French. That size is telling you the diameter of the catheter, how thick that bad boy is. Okay. From this little, looks like a little tiny tube going in you use for a baby, all the way up to 10 French, which is usually used for adults. Okay. Again, you pick out the size catheter you want. The kit tells you what size catheter is in there. This is a 10 French catheterization kit, and you got everything you need already in there. Now, in some organizations, PCTs might get into doing this, putting catheters in, but because of the amount of infections that happen with this, it's usually reserved to the nursing staff or the RNs to put these in. RNs or doctors. In the military, we did them because you can't sue the military. That's true. Yeah. We did all kinds of cool stuff in the military because people couldn't sue, including suturing. And emergency room technicians did all the suturing. Remember I told y'all I've been sewing for years. The only place we didn't sew was on the face or on the hands. Everything else, we sewed those. And you probably won't get the opportunity to do that as medical assistants out here in the world. Remember that too many doctors practice law rather than practicing medicine. They do whatever it takes to keep from being sued rather than do what's best for the patient. All right, so that's what a catheter is and what we're doing with those things. All right. And then the urinary catheters. All right, so get those, voiding, and then incontinence. All right, just like with the penias last module or yesterday, and all of this will be on the same test. You remember all those penias you saw? Well, here are the ureas, and all on the same test. But the suffix or prefixes all mean the same thing every time you see them. Remember, apnea was absence of breathing. If you put an A in front of urea, and urea, A or AN, both mean without. So anuria is the absence of urine. Poly means many, M-A-N-Y, many. So it's translated as excessive urination. People are peeing a lot. Reminds me, once I had this patient who was suffering anuria, and he was on a catheter, but he was posied into the bed. A posy jacket is like a backwards jacket that goes over the patient, like over the front. They slip their arms in like this, and it's solid in the front, no zippers or anything like that. And it's got these long tails on the back. So when you put a person in a posy jacket, you can use the long tails to tie them to the bed or tie them to the chair. Remember, you need a doctor's order to do that. So this guy was posied into the bed. He was tied into the bed. But his urinal was always empty. And the doctor was accusing us of, emptying the urinal and not writing down his intake and output, which is a very, very important part of what we do. You're going to record everything the person drinks. So every glass on the ward, it'll tell you how many cc's are in that. So if you, the cup that comes up with their breakfast tray that has the orange juice in it, you've got a little cheat sheet to tell you how many cc's that is. That's 100 cc's. So when you drink that, when they drink that, you go to their intake sheet and you put 100 cc's. This is how much they drank. We have the equivalent for soda cans and so on, making sure that we keep an accurate count of how much fluid they're putting in their body. And then when they pee out, we take their urinal or their urine bag, we see how much is in there, 300 cc's, whatever they're putting out. So that's the intake and output, or I and O. In reports, you'll hear patient room 7, bed 3 is on I and O. Okay. So make sure you're recording everything that goes in and out of their body, fluid-wise. So this one patient, his urinal was always empty. And the doctor's like, well, y'all guys are not recording their intake and output, or his intake and output. And I'm telling him, yes, we are, doc. The guy's not peeing. Well, he's got to be peeing. Look at this input. He's had 700 cc's yesterday. And you tell me he had no output? Doc, he had no output. What do you want me to tell you? As a matter of fact, I'm kind of embarrassed about doing this, but I actually picked up the urinal from the side of his bed. They kind of hang on the bed rail. I picked up the urinal, popped the cap head, smelled it. Doc, see, this is a brand new urinal. There's never been urine in this. Well, something is going on. Well, I don't know what to tell you. We're recording everything he puts in, but this man is not peeing. He's posing into the bed. He can't get up. He's not peeing. What do you want me to tell you? So during this whole scenario, I'm in the room at one point, and I'm working with the patient in the bed next to his. I've got the curtain drawn. We're doing what we're doing in there, and I hear the toilet flush. I go, wait a minute. I'm the only one in here. Who just flushed the toilet? So I peek out the curtain, and there's the little dude, the one who's supposed to be posing into the bed. He's coming out of the bathroom. Little old dude, little old skinny man. And he creeps over to the bed, and he lays down flat on the bed, and he wiggles his way back up into the posy jacket. So when he wants to get out and go to the bathroom, he just kind of wiggles his way out, gets up, goes in there and pee, comes back and wiggles his way back in. So mystery was solved. He was peeing. He just wasn't peeing in that damn urinal. He was getting up, going to the bathroom. So anyway, that is anuria, absence of urine. Poly means many, so it translates as excessive urination. Oliguria. Oligo means scanty or few. So they got a decrease in urination. They go and it's just a little bit each time. You might experience that with pregnancy. You go in, you pee, beep, beep, beep. That's it. You get up, 10 minutes later, you got to pee again. You're having oliguria. Nocturia. Nocto means night, like nocturne. So nocturia is excessive urination at night. You're peeing a lot. You're getting out of bed 2 or 3 times a night to go pee. Right now, for me, I'm at like 1. I cannot get through the night without getting up to go pee 1 time. So I get up and I creep through the house, and I always go in the, because remember I sleep most of the time in my man cave. You always go into the bedroom with my wife, go in there and use that bathroom. Why you don't use the other bathroom? Because I want to wake you up. Since I'm up anyway, you might as well get up with me, wake up with me. Give me a little sugar, some num-num, so I can go back to bed and sleep good. So anyway, nocturia, excessive urination at night. It's one of the things we ask you when you join the military, or when you're joining the military. How often do you pee at night? Because we want to know why you're up moving around at night when everybody else is asleep. Remember, these people are from all over the world. We don't know these folks. And all of a sudden, everybody else sleeping, you're up moving around the dormitory at night. We want to know why. Do you get up and pee a lot at night? Glycosuria. What do y'all think that one is? Glycose is sugar in the urine. Now remember, with diabetes, it is not the blood that tells us you have diabetes. It's the urine. Once we see sugar in your urine, there you go. That's your diagnosis of diabetes, especially if we see ketones in there as well. So hematuria is blood in the urine. Bacteriuria, bacteria in the urine. You got a urinary tract infection somewhere. Pyuria is pus in the urine. It makes the urine look kind of cloudy. It looks like a cloudy day. Look in there, you see clouds floating in their urine there, pyuria. Albuminuria, we're seeing proteins in the urine. Remember, proteins shouldn't be there. If proteins get through the kidneys, they're pulled out by the peritubular capillaries. So we shouldn't see any proteins in your urine. That's an abnormal result. And then dysuria, painful urination. DYS, painful, difficult, or bad. So it burns when they pee. They got dysuria. And I want to add one right now. I'm not sure it's on the test, but I'll add it anyway. Ketonuria. Ketonuria is when you have ketones in the urine. And if you see these two together, ketones and sugar both appearing in the urine, that's your diagnosis of diabetes. Ketones are the byproduct of burning fat instead of sugar. So when you burn the excess fat, when we burn sugar, we make CO2, we breathe it off. When you burn fat, you make ketones. And those, the only way to get out is through your urine. So they're not burning the sugar. That's why it's appearing in their urine. They're burning fat instead, and that makes ketones in their urine. When you see both of those together, that's the diagnosis of diabetes. Ketonuria plus glycosuria, sugars and acetones. So those are your ureas. All of them will be on your test. And on your review that I'll be sending out here in a little bit, it simply says down there at the bottom, know the ureas. There they are. They're also in your textbook as well. But later on down here, they start right here on page 546. Albumin, anuria, bacteria, dysuria, glycosuria, hematuria. Did we do hematuria? Oh, there it is, yeah. Hematuria, and then moving over to the next page, ketonuria, nocturia, oliguria, polyuria, and pyuria. Okay. So all the ureas are also in your textbook as well, but you can get them from the slide. Know the ureas. They will all be on your test. And the last thing we want to talk about today, I told y'all we'd finish up early. The last thing we want to talk about today is the urinary tract infection and what's happening with these people. All right. The most common cause of urinary tract infections in the hospital is urinary catheters. When I was working the wards out in California, and we had at least 10 people on catheters on the ward every day, we were doing a lot of catheter care, a lot of catheter changes every day. They got a new urologist who came there from some other base. He was going to be the chief of urology there at that hospital. And this was a 7-story hospital, so it was a pretty big place. But anyway, he shows up at the place, and the first thing he does is he sends out this letter to all the departments, telling everybody in the hospital that you will not catheterize males in this hospital unless you are a urology technician. In other words, unless you work for me. So you're not doing any catheters here if you don't work for me, the chief urologist. So we sent him back our schedule. There you go, Holmes. Shit. No argument from us. See y'all at 4 o'clock in the morning. Oh. So he backed off of that. He sent out a second letter that says, if you do catheters in this hospital, you will be trained by me before you do them. Okay, well, come on up and teach us then. So we set up, had a patient who needed to be catheterized anyway that day, volunteered for his demonstration. So he comes up to the ward, man, and we're all standing on one side of the bed. He's on the other side, got all his equipment and everything. And this is my first chance to mention George Castaneda. He was my first Hispanic friend. He was from East LA, straight up machismo, jet black hair, like Eric Estrada type, every hair always in place, carried a brush in his back pocket type thing. George looked like John Travolta a little bit. So anyway, George standing next to me, and we're watching this dude. And he starts out with, he looks at everybody, he's looking down at his equipment, and he looks up at us and he goes, okay. And he literally smacked his lip. Did he just smack his lips? Then he keeps going. Now, when you catheterize a male, it can be quite traumatic. So you need to use plenty of lubricant. Okay. Which, we know. And so he's like, so what you're going to do is, y'all saw the catheter in that picture, you stretch that out and you take that little packet of lubricant and you smear it along the catheter. So you're going to get plenty of lubricant on the catheter. Okay. And now, save just a little bit, because you need to put this is a male patient, you need to put a generous amount of lubricant right at the urethral meatus. The meatus, I haven't used that term. The meatus is the opening that leads in. So like here at the ears, right there where my finger is the external auditory meatus, the opening that leads in. The urethral meatus in men is at the tip of the penis. And in women, it's right above the vaginal canal. So he says you're going to put a generous amount of lubricant right at the urethral meatus. And then you need to get that lubricant into the urethra. So you're going to milk it down into the meatus. So he's actually holding his penis upright and milking the down into the penis. And the guy is looking at us, the patient is looking at us, and we're looking at this dude like, really? So I leaned over to say something to George. I don't remember what I was going to say, but I leaned over to George like, man, I ain't milking nothing, like real loud. And the guy looks up, is like, it's important that you milk, okay? Milk down into. So maybe, I don't know, a week later, George is in there catheterizing a patient. I walk past, the curtains are pulled, but I kind of glance in the curtains. And this dude had a raging erection, y'all. And George is trying to get the catheter in. Now, first of all, somebody's got an erection, you stop. You don't do it. You come back later. But anyway, George is trying to get the catheter in with this raging erection. And I was like, oh, okay. So I'm out there. And George comes out the room a little bit later. I was like, George, you was milking, wasn't you? Like, man, I wasn't milking nothing, Holmes. Everything was Holmes with George. No, I wasn't milking nothing, Holmes. But from that day forward, he was known as George the Milkman Castaneda. So anyway, in there milking. So urinary catheters are a common cause of urinary tract infections, especially in men. All right, now men themselves, now the most common issue, men shouldn't be getting circumcised, shouldn't be getting UTIs, period. So if a male is getting a UTI, you got to wonder why. Are they just dirty? They're not cleaning themselves, or are they uncircumcised? And a male who is uncircumcised means that the foreskin completely covers the glans penis. Now, when this person urinates, they need to pull the foreskin all the way back to completely expose the glans penis before they start urinating. Urinate, then release the foreskin. And what I tell uncircumcised males is to wipe the tip of the penis or dry the penis before you release the foreskin. If you don't do that, if you don't pull the foreskin back, if you're just lazy or you're just 10 years old and it's the middle of the night, you might walk in the bathroom and just pee right through the foreskin. If you do that, you're going to build urine residue under here. And that's going to stay moist, dark, warm, and it's going to have nutrients or dead skin cells and that type of stuff in it. Anybody remember this list from last module? Moist, dark, warmth, and nutrients. The thing that bacteria need to grow. So under there, all kinds of bacteria growing under there. That makes its way into the urethra and causes the UTI. So uncircumcised males should retract the foreskin before urinating. And then, like I said, I tell them take toilet paper and wipe the tip of the penis before releasing the foreskin, or dry the penis before releasing the foreskin. All right. So that's the most common cause of urinary tract infection in men, is being uncircumcised. Now, what about women? Okay. UTIs can be caused by the type of underclothes. If it's riding up in your crotch and that type of stuff, thongs, anything that just rides up or doesn't have a cotton crotch, is going to allow moisture to build and cause UTIs. Cotton absorbs the moisture and takes away one of those things we talked about over there: moisture, darkness, nutrients, and so on. So cotton absorbs the moisture. Okay. So the type of underclothes somebody is wearing. Douching. Back in the, I don't know how common it is today, but back in the day, I remember going in the toilet asking my mama, what's that right there, mama? Boy, it's a hot water bottle. Get out of here. It's like the hot water. It looks like a hot water bottle. Yes, the little reddish orange looking thing, but it has this long white tube hanging on there with a little hard part at the end with holes in it. Mama, what's that? It's a hot water bottle, boy. Get out of here. Mama, how come it smells like vinegar? They used to douche with vinegar So anyway, today we know that one, it's not really necessary, and two, it does lead to urinary tract infections. Dehydration, not drinking enough water, can lead to urinary tract infections. How much water should you drink a day, you think? We're in San Antonio, Texas.
64 ounces.
How much, Jaime? What'd you say?
64 ounces, sir.
64 ounces. How many are in those water, your basic water bottle? I'm not talking about the real big one, but the one you just
12.
kind of get over at HEB. That's 12 ounces? Okay.
Yes, sir.
So yes, about 8 of those a day. So you're right. Yeah. About 8 of those a day. If they're 12-ounce bottles. Yeah. So dehydration, make sure you're drinking plenty of fluid, especially in Texas. Y'all remember Texas is San Antonio sits in the middle of a desert. It's hard of us to think of that way because we live here, but San Antonio is a desert, and that's based on annual rainfall. Holding your urine. I've heard this one before, but remember my wife is just one example. But remember I told y'all my wife doesn't pee at work. She holds her urine all the time. She's never had a UTI in all the time we've been married. But she also doesn't take baths. We got the double bathtub in there with the 2 people can sit in there and get all da-da-da-da-da. You can run your hand through and pick up the dust today. Nobody uses the thing. Everybody here showers. So bathtubs are hot tubs with the chemicals in the water, the bubble bath in the water, the debris or dirt that builds up while you're sitting in the water, both lead to UTIs as well. Letting the bathing suit dry on your body. Like you go to Fiesta, Texas, and if you ever been to the water park in Fiesta, Texas, you know, as you leave the water park, there'll be an attendant standing out there making you put your clothes on before you go out into the regular park. They don't want you to walk around the park in a bathing suit. So what do people do? They take their shorts, put them right on over their bathing suit, and then walk out into the park. Now the bathing suit is underneath them and drying. And what do you get underneath that inside your shorts now? Darkness, moisture, warmth, nutrients, oxygen, it's all there. Bacteria will grow. Yeah. So not letting the bathing suit dry on the body, taking a change of clothes before you leave the water park. Scented toilet paper. This is the chemical from whatever perfume they're spraying into that toilet paper. Toilet paper with printed pictures on it. This is the ink for whatever dyes they're using to put the pictures on the toilet paper. Dirty sex. Sex with a dirty person. I know I'm not trying to kill it for y'all, but just the body is dirty. And sex in any kind of water. I know I just killed it for half of y'all. The shower, the tub, whatever, off limits. No sex in water. Especially not lake water. How nasty is that shit? So those are things you should avoid to keep down or avoid having urinary tract infections. And probably the most common for women is dehydration and probably holding urine. All right. So if you're getting repeated UTIs, it burns when I pee, look at what you're doing. Is there anything you're doing that's perpetuating the UTIs in you? UTIs can also be caused by some medications. Like, for example, did you know that antibiotics can actually cause kidney infections in people? So medications you're taking could be leading to UTIs. Okay, so if you get a urinary tract infection, you can run on over to the doctor and go on the antibiotics and pay for the visit and pay for the pills and all that mess. Or what could you do just from home? Almost everybody knows this one. What's good for UTIs? home remedy.
Cranberry juice, water.
Cranberry.
Cranberry juice. It worked for me. I got my first UTI because, about a year or so ago, I started getting enlarged prostate. So I had a UTI. So I told him, well, damn, babe, I got a UTI. Go to the store and get me some cranberry juice. And it took one jug. I started on it on like a Tuesday or something like that. By Saturday, no problems, all gone. And remember, with the antibiotics, it's going to be like 10 days. Cranberry juice just in a couple of days will knock out that UTI. So it's one of those things, again, a doctor would never tell you that in the clinic because it would be considered medical advice. And if they told you to go home and drink cranberry juice and turns out that it was a kidney stone or a urinary stone that was causing your pain and it goes undiagnosed and the urethra tears or whatever, that's a lawsuit. So doctors won't tell you cranberry juice because it's not the standard of care. Remember, too many doctors out there are practicing law instead of practicing medicine. All right, so that's a UTI and what happens there in our urinary system, the most common issue that people are going to have with their urination. So let's go back through here real quick. The retroperitoneal space, be able to pick out the correct spelling for that. You'll be given 3 or 4 examples and you pick the one that's spelled correctly, the name of the space where the kidneys are located. The hilum is that indentation on the medial surface of the kidney. Remember, medial is always towards the middle. So it's the dip in the beam facing the middle of the body. Paello is the root word for renal pelvis, that part where all the urine is collected in the kidneys. Erythropoietin doubles the rate of red cell production, and renin causes vasoconstriction. The periodic table symbol for potassium is K. Nephrons are the functional units of the kidneys. And the renal corpuscle includes the Bowman's capsule and the glomerulus. The other part of the nephron is the renal tubules. Part 1, part 2, and then the 2 parts of the renal corpuscle. The tube that leads from the kidneys to the bladder is called the ureter. And if you have kidney stones or presence of kidney stones, is nephrolithiasis. Nephro is kidney, litho is stone. Nothing in here, so I can erase that. The urethra leads from the bladder to outside the body. Voiding means to urinate. And incontinence is the inability to control urine flow, in this case, urine flow. And then all your ureas. One other thing I want to talk about before we finish is the 2 most common conditions that damage the kidneys and how they do that damage. It happens primarily at the glomerulus, where you have your Bowman capsule flowing in and out, the glomerulus inside there with all of its openings. Allowing small things to flow through, but big things get returned to urine flow or back to the blood. Now, where the damage happens primarily in people's kidneys is going to be at the glomerulus, the filter. And the first type of damage is that person who has diabetes, and they end up with a diabetic nephropathy. What's happening to these folks is that as the sugar flows through their kidneys from the diabetes, that sugar starts to gunk up the openings or pores in their glomerulus. And they become all blocked up with sugar. And as a result, everything gets returned to blood flow. So all those nutrients that are all those waste products that are coming in here that should flow out, they can't flow out because they're blocked. So they go back into the bloodstream. So their kidneys are not filtering anything for them. They have diabetic nephropathy. And there's no way we can treat this except with a kidney transplant. Remember, these glomeruli, all of them, all 6 million of them are all clogged up like this. Now, the other damaging condition, and that's if you have diabetes, the other kidney disease that damages our kidneys more than any other is high blood pressure. Hypertension. And hypertension does exactly the opposite of diabetes. The pressure coming into their glomerulus is so great that when it gets in there, all of their pores get blasted open because the pressure is so high passing through here. And that's what their glomerulus looks like. So everything, including the blood cells, pass through and are getting into their urine. So when you have albuminuria, proteins in their urine, that's a classic sign of high blood pressure. The blood cells and the proteins are all getting through there because their glomerulus has just been completely obliterated because their blood pressure was so high. Again, they're going to need a kidney transplant. So the two most devastating conditions to our kidneys are diabetes and high blood pressure, doing exactly the opposite each other. Diabetes clogs up the kidneys. Hypertension blows them all up inside and just lets everything just flow through. All right. And they would call that diabetic kidney disease. Either way, both those people are going on dialysis. Dialysis is when they take the blood from your body, usually through a shunt put into your arm, take it into the machine filters the blood and puts it back in it for you. It takes about 3 to 4 hours to do it, and most people do it about 2 times a week. So it's not something you have to go in for every day. And when you do have dialysis, you'll usually go in at about 4 o'clock in the morning. We want to get that 3 or 4 hour procedure done in time for them to go to school and go to work. So we do those things first thing in the morning like that. So if you want a type of job where you go to work at 4 o'clock in the morning and get off at noon, dialysis center. Usually by 12 o'clock, they're done with most of their clients. And only the old retired people come in the afternoon. All the kids, all the working adults come in at about 4 o'clock in the morning. Get that dialysis done and still get to go to work that day. So if you want to get off at noon, there you go. That's a good environment for you. I kind of like that, getting off at 12 o'clock, when we're over at the building and stuff. By 1:30, I'm home. Before traffic, I can still get to the mall or Walmart or whatever before the crowd shows up and da. And by the way, that's how my wife and I do it now. We go to the malls before anybody else gets there, or during the week, Tuesday, Wednesday, or whatever. We do not go to the mall on Saturday mornings, that kind of stuff, just to stay away from the crowd, y'all. And when it starts to look like it's getting a little bit too crowded, we get the hell out of there and go home. Just too much crap out there. And did you see the thing on the news yesterday that those, what do they call them, gator or whatever those things are that cover the mouth and hang around the neck, they're even worse than not wearing anything at all. So those little gator things people wearing up here think they look cool, are doing more damage than good because they're breaking up the particles even smaller. So they're not blocking them, they're just breaking them up and sending them out in the smaller particles so they travel farther. So they say wearing that thing now is worse than wearing nothing at all. So there you go. All this science coming out. I think they're just overthinking things today. But anyway, those gator things are not supposed to be very good at all. So that is your urinary system. So what we'll do right now is I'm going to save that because I changed some orders. I don't need to resend it because all the reds are still there. Why did that happen? I didn't mean for that to happen. Okay, there we go. I'm not going to send it again because all the reds haven't changed. I just changed the order of stuff. So I want to go in here now, and I think y'all know what I'm going to do. I'll go on and activate the quizzes for pulmonology, urology. It's Thursday. Yeah. All right, so there's your urology pulmonology quiz activated. Due no later than Thursday before we start class, preferably. And go ahead and attach your review. Is right there. Respiratory urology review. All right, so there's your quizzes link and your review. Go ahead and open that review, guys. Get started studying on that if that's what you want to do right now for these 2 hours. You got 2 hours today. Homework, quizzes, whatever you think you need to work on and get done today. Again, do not be treating this like, oh, look, I got out of class early. Treat this as, oh, look, I have time to go and work on something and use the time effectively. I'll leave the meeting open. I might not be in earshot the whole time because this headache is just kicking my ass, y'all. It's like being like motion sick. I'm really having some issues today. So let me send that before I forget. Okay. I'm getting homework from folks. I'll get that squared away. Okay. And tomorrow, I'll be talking to the folks who are leaving me at the end of this module about where you're going and what the contact is for that teacher and so on to make sure that we get that done. So if there are no questions right now, I'm going to step away. I'll leave the meeting open. Y'all can talk back and forth. If you need me, if you speak up, I might hear you. So go ahead and speak up if you need me for something and kind of get started on that stuff that, you need to get done. So any questions before I log off or before I step away? Now's the time to ask. And if not, we'll see y'all tomorrow morning at 8 o'clock. We'll be doing the skin tomorrow, dermatology. Go here, go here. Anybody got any questions that you're working on? Anything? Close my eyes for a little bit. I feel a little bit better. If not, keep working. But I'm here.
Mr. Mahone, I sent a homework twice, but for the fact that I hadn't put Linda Lopez and chapter. I sent one twice because one has no subject.
Okay, I got you right there. There are no questions, and I'll go on and close the class for today. We'll see y'all tomorrow morning at 8 o'clock.
Have a good evening, Mr. Mahone.
All right, see y'all tomorrow.
All right.